Hi everyone, my name is Alter Good and I'm really excited to start this channel. So this channel is going to be focusing on chronic pain and fatigue conditions. You might be asking what those are because you guys are not most likely familiar with these conditions. These conditions are those that don't really have any visible symptoms, are those that don't really have any visible contributing factors. They generally occur in healthy people. And as a result, they're very difficult to diagnose, which I will elaborate on later in other videos. But there's three conditions that I'll be focusing on: fibromyalgia, chronic fatigue syndrome, and Gulf War illness. But before I discuss these conditions, I do want to talk a little bit about myself because you might be curious as to why I'm doing these videos, and you might be curious about who I am. So I'm a Master of Public Health student, and I also majored in neuroscience, and I graduated in the spring of 2023. Both of them are through the University of Alabama at Birmingham. And when I was in my neuroscience program, I started working in a laboratory called the UAB Neuroinflammation Pain and Fatigue Lab, run by Dr. Jared Younger. And this lab focused on these conditions. So I was part of two studies. One of them was about the genetic biomarkers of chronic fatigue syndrome. So we tried to analyze blood samples and questionnaires to determine if there is any genetic correlation with any of the symptoms that were exhibited in patients with chronic fatigue syndrome. And we also, I also worked on a thesis where I worked with data from Gulf War illness from veterans, and we looked at if plants known to reduce inflammation actually improved symptoms for veterans. So I have a lot of research experience in these areas, but I realized through talking to patients, especially for chronic fatigue syndrome, that there's also a not often discussed socioeconomic and public health portion to these conditions. We often look at the biological and the psychological aspects, but we don't really talk about the socioeconomic determinants of many diseases, but especially these diseases, because they're not really fully endorsed and supported by the medical community, and there's still a lot of stigma to overcome in order to appropriate more funding for research, especially in the public health area for these diseases. So I wanted to create a public health outreach program that focuses not just on the biological factors of these diseases, which is very important to cover, but also on the socioeconomic factors and about what some social inequities are when it comes to the patient demographics, and what are the challenges that patients face due to their socioeconomic status. So in this channel, I'll be using my training both in public health and in neuroscience to explore this topic. So I'll be, in the following videos, I'll be discussing fibromyalgia, chronic fatigue syndrome, and Gulf War illness. And I'll also make one additional video, at least for the foreseeable future, where I am focusing on some more speculative areas, because again, this is an area where there's not a lot of research, and the medical field and the research community are just coming around to exploring the socioeconomic factors that are associated with these conditions. And I also want to tell you guys that I am also creating a blog post that will greatly complement these videos, and I'll also be posting the references that I use to make these videos. Of course, there's a lot of research that goes into this. I had to analyze some research articles. I had to, of course, read some regular articles. So again, there is a lot of research that goes into this, but I want you guys to be able to look at and examine the resources on your own. So I'll be posting that in the details of the video as well. But again, I am very glad to have established this framework, and I'm really excited for this channel because I think that this is a very crucial issue that must be highlighted, and I think that it is essential for us to have a conversation about the impact of socioeconomic factors on these diseases. Because again, as we'll later explore in other videos, there are millions of people around the world and in the US that are impacted by these diseases. So there is a real world impact, and we must learn about not just the biology, but also the public health portion of it. So once again, thank you so much for watching this video. Please feel free to subscribe, and I'm really excited to commence this project. So thank you very much for your participation.